is Sainabou Jobe. I'm from West Africa, the country named Gambia. I work in Edward Francis Small Teaching Hospital in the hemodialysis unit. And I'm here because I was recommended by the First Lady, Merck Foundation. For now, in our country, we are yet to have a fully oncology department. We just have a preventive oncology, which we see on outpatient for cancer patients. And also we are looking forward to get a oncology hospital where we will have patients that we can check fully treatment for cancer. We don't have much specialties for oncology unless they start doing it now. But for this training really help because now we will have nurses who will be trained fully for this oncology. But we have less number for now. The rural areas, we don't have screening. We only have screening in the capital, which is the hospital called Edward Francis Small Teaching Hospital. That's the only place that they have the screening. So anyone that is suspected or queried cancer, they send them there to come and do the screening and all the stuff. We can say is like 30% awareness because cancer is not common in Gambia. Yeah, it's not common. Because like every population, like if you have 100 people, maybe 10 to 5% will, if you ask, only 10 to 5% will able to answer about cancer and the treatment and so on. It's very important to us, the country also, because for us during our school time, what we do in oncology is just the introduction. We do the introductive, then we don't go deep unless you read. And if you read, you don't practice because all about nurse and doctors, yes, you read and know the theory, but also the practice is the most important thing. So if they can open a new, if they can open a good oncology unit where we can do our training and also practice very well, yeah, that will help the country a lot, yeah, and us also. Before I came here, I was very nervous because I was coming to a country that I don't know anything about. But when I came here, it was a bit hard to us. But when we start coming to the hospital, after seeing like real cancer patients and all the struggles and the sufferings they are going through, it really motivated me. Yeah, I was really motivated because I said I will do my best to learn some new things here so that when I go back to my country, at least if I see someone or people suffering from cancer, at least I will be able to do something. My first posting was in chemotherapy department, which is the chemotherapy department, where they admit patients and give chemotherapy medications. So at that place, I was able to learn how they prepare the medications and the type of medications they give and then all the protocols that are followed during the administration of medications. And it was very helpful because I was I was only read about these chemotherapy medications, but I was never able to observe. And then also the types of line that they prefer to give with the chemotherapy medications or any other medications that they are administering for the cancer patients. Also, these peripheral lines that they use to administer the chemotherapy, which is very good for the patients and also very healthy for the patient also, and for young kids and babies. These peripheral lines are very good for them, and I was never ever observed them when I was in my country. But since I came here, I was able to observe all those things. Though I was working in a hemodialysis unit in my country, for the cancer patient, yes, in privates we have cancer patients, but by that stage we don't manage them. Only if they come with preventive, like the screening that we do there, and after we send them to public hospitals where they ask them to go and do the necessary things. If they cannot take care of them, they can just ask for the medical certificate for them to go abroad. But if I go to my country with the help of the government, if they can provide all these health facilities and the Oncology Health Center, where they can provide all this chemotherapy and have the specialists who will come there and assist we the nurses to do the best for our people. What I will give them as an advice is that when they come, they have to obey and also be very serious about this training, because this training is very important and it will really help when they go back to their country. And they also have to follow all the medication protocols and then the hospital protocols also, because when you are coming to a hospital, you have to obey the rules and regulation that will lead you to have a good coordinator, and also it will lead them to make more effort to help you and put you through like what they do here and everything that you need to know about the oncology. I will say thank you very much to Merck Foundation and the entire team, because this is a very interesting and a very helpful training that you have offered for us and our nation also, because this training have been a very, very important training for us.